Welcome to our presentation, To Stand in the Gap. We want to propose standing in the gap and methods of how you reveal gaps as a feminist, activist approach to how knowledge works in the academy and how we can understand the structures and systems of the academy. Our presentation reflects on a paper that, to be honest, took us almost half a decade, where we attempted to join up what we knew as researchers, practitioners, and people with real life experiences of working within data and policy structures in higher education.
So this article has just been published in the Sociological Review. So if you are interested, you can read it in full. But I want to say a bit that's not in the published article about the origins of the paper to acknowledge where we started from. So Susan and I were talking several years ago at a major conference, or rather outside a major conference for our discipline, in one of those kind of fringe discussions around the conference. And we found ourselves connecting over our passion and our work to address the systems and structures of higher education. And on this occasion, we were both experiencing frustrations with how policy and practice in the systems of higher education was not using or listening to the empirical evidence that we knew, both from our own research and data gathering, as well as our own individual experience, whether that was our personal experience or our observations of watching policy and practice fail in higher education. So this was in our two areas, one of which is sexual misconduct, my work with the 1752 group, which is kind of activist research on sexual misconduct. And we've done a national UK survey and qualitative interviews with complainants. And for Susan, that was research for her Students' Union on PhD wellbeing, including orthoethnographic, multi-method, and a literature review, focus groups, and survey analysis.
Why stand in the gap? Well, standing in the gap is to assume a position of active, resolute defence, either for or against something. So we want to use this paper to present gaps we've encountered personally through practice and through our research. But also we want to do this to stand in these gaps, to join up evidence and data and policy related to these two linked and vital issues of sexual misconduct and PhD wellbeing, that the academy treats as unrelated, and we argue that separating them allows for lack of care, as we'll come to later. We'll offer an overview of our rationale for our approach and our methodological developments. We'll also present our findings in terms of how these issues are misrepresented and who that serves, and how these are policy problems that urgently need addressing.
So as we've noted, the two issues that we brought together are that postgraduate research is more likely to experience both staff sexual misconduct, from academic staff particularly, and poor wellbeing. And so, of course, this paper is critical of higher education data, and the data that exists in this area isn't excluded from these critiques. But just to explain what's kind of already out there. Women postgraduate students, and particularly LGBTQ women, are more likely to be subject to sexual misconduct from academic staff as opposed to undergraduate students. And this is from two large-scale surveys in the US and Australia. And on wellbeing, again, there's a lot of inconsistency in the data, very difficult to measure. But Nature suggests that over a third of PhD students internationally have sought help. And similarly, just under a third had shown signs of major depression, anxiety, or panic disorder in the last 12 months, according to this 2018 study. Academics' estimates of mental health issues across the student body in the UK range very widely. So, there are issues with the data suggests there's a problem. We are critiquing this data and how it represents the problem. But indeed, it is alarming and warrants attention.
So sitting around that pub table some 5 years ago, we weren't discussing these stats, but the issues. And crucially, we both found ourselves with shared experience of issues of evidence in practice. So higher education wellbeing literature rarely draws on critical literature about systems. Instead, it speaks of services, whether wellbeing services or academic provision, reams of stuff on good or bad supervision and how that affects the student, or take-up rates for mental health services, or why students don't interact with the services provided. Now, of course, we are not saying that these things aren't true or important, but this kind of research doesn't start with the experience of a student, because it starts with isolated determinants of well-being or mental health from a medicalised perspective, and starts from the perspective of the institution wanting to evaluate its own services. Alongside that, academic research that's quantitative will look for the relationship between one thing that's thought to affect well-being and another proxy of well-being, whether that's mental health or anxiety and so on. So this really doesn't account for the fact that well-being is multidimensional experience, and it obscures the actual cumulatively injurious effects of doing a PhD, because it's too hard to listen to students properly at scale for the kind of default approaches.
So despite these limitations of the literature reviews, higher education claims that it is evidence-based. Its decision-making, its policy-making is evidence-based and data-driven, but it's relying on certain narrow forms of evidence, primarily surveys of the student population or systematic reviews. So these forms of data rarely account for actual experience or for intersecting inequalities. And the politics of how well-being is framed in these systems tends to be lost. So issues such as the two we've brought together in this paper are separated and not made visible in the well-being literature in particular. So these types of methods obscure the causes of ill-being, including sexual violence or misconduct from staff. And then what happens is that these issues are evaluated in terms of, the interest groups, whether that's the interests of the sector, the higher education institution, or advocacy organisations such as in the UK, Student Minds, rather than those of students. So, the university might carry out an evaluation of its wellbeing centre. So the issues that are causing ill-being, as you might want to call it, are obscured because they're not being looked for, and therefore they don't appear in any of these types of evidence. But we know that these issues are related, so we do need to look at things differently.
So I was really keen to apply an approach that I'd used before and that I call reperformance. And this means you reperform standardized methods to look at a proposed policy issue or research problem in context. So you're kind of reproducing the dominant methods to see how they work, whilst also drawing on ethnographic and desk-based methods to understand the broader context of how and why issues just may not quite make sense in terms of what is evidence. This allows you to look at these issues and context of evidence in the round, I say, because it reveals procedural oversights and foregrounds who is overlooked as evidence and in solutions. So we applied the reperformance approach to systematic reviews. And systematic reviews are often used to inform policy or identify gaps in the evidence base. They ordinarily involve searching databases using key terms, and these words, of course, are used differently by specific epistemic communities. Now, this systematic process will mostly generate a long list of possible research papers that could be included. Then the systematic review involves a series of processes to review the long list and identify what to exclude. So these decisions are often ones of epistemic injustice. How big is the sample? Is the method considered robust according to specific criteria? What is the discipline? What was the journal? Where was the study? This approach is actually about finding what evidence to exclude before deciding on what you will focus your analytical attention on. Therefore, it works on certain criteria, it reinforces certain knowledges and invisibilizes others, reinforcing epistemic difference and omitting certain publications. So, Inevitably, systematic reviews tendentially exclude research which includes particular knowledges and in-depth experiences, whilst also relying on limited keywords which tend to be things that already go together. So how can you review literature differently? In addition to the approaches above, I undertook what I call a snowball search, which means I followed the bibliographies of relevant publications to follow their references and so on. I followed social media posts to blog posts and newspaper scandals, listening to podcasts and finding references to someone's conference presentation that had disappeared from the archive. Now, these aren't unusual approaches, but they are feminist approaches to listening and seeking out the experiences of others that weren't being made visible by the dominant evidence base and approaches. I then coded this database to have an overview of how many studies lumped all students together and described them as if they were all 18, or I looked at whether they emerged from a questionnaire to a large population and so on. I did this to look for experience of well-being and to see patterns in the evidence base on which dominant narratives are derived. I then showed the headline findings as to what I thought was going on in the wellbeing literature with Anna to map certain issues against what she knew from the sexual misconduct evidence. So alongside all of this was all the parallel work to understand higher education policy, practices, and so on, with regards to data and evidence and how they affected decision-making with regards to providing care and protecting from harm. This allowed us to look at the two issues together in the round. And this formalized the way that we were joining our knowledges together and enabled a series of findings about mistakes made in the care and protection of PhD students that Anna's going to introduce.
What we want to do is try and reveal how aspects of the PhD experience, particularly the cultures that cause ill-being and enable sexual misconduct, are silenced in existing evidence making. Our reperformance of the systematic review uncovers numerous issues in the status quo, and we focus on three of these. And these organising modes conceal a lack of care, as well as staff sexual misconduct and poor well-being. So they are the misconstruction of the typical student in well-being literatures, the misconstruction of the phenomenon of well-being, exacerbated by generic survey tools which focus on a medicalised model of mental health. And my favourite one, the misconstruction of higher education institutions as integrated, agential, and ethical, aided by the fragmentation of administrative systems and of knowledge production between disciplines. And the other key things we found were in policy and practice. So one of the issues we found is the increasing responsibility for PhD wellbeing being devolved from the institution and individualised onto the supervisor. So the supervisor becomes the person who is becoming more responsible for their PhD students and for PhD students' mental health. And, for example, through training on mental health pastoral support being provided to supervisors. But this becomes fundamentally problematic when we look at it against the increased emotional reliance on supervisors as leading to the risk of staff sexual misconduct. But also, more generally, expecting a supervisor by default to be good in the pastoral role is not necessarily realistic. A further finding was perhaps for me one of the most interesting synergies across these two areas, a pattern of institutional listening while silencing. So what we mean by this is that people who disclosed issues might get an initial sympathetic response of listening, and the institution might listen through the provision of listening services. This is, of course, linked to putting the supervisor in a pastoral listening role. But then, following that initial kind of sympathetic response to disclosure, any kind of appropriate action being taken was much less likely. So the silencing after that initial listening and silencing students' narratives of experience, of poor experience, because the feedback mechanisms silo student experience rather than account for its multidimensionality. So I called it previously a Janus-faced response, because initially students are relieved to get a positive initial response, but then they realise that that wasn't true because it doesn't follow through to any systematic support. And finally, these structures of feedback fail to reveal the loops between patterns of vulnerability. So the ways in which inequalities actually make people more vulnerable to staff sexual misconduct, to ill-being. So there's a kind of feedback loop between being already part of a marginalised group and then becoming more vulnerable to further harm.
So unless you look at how these things are happening in the round and as cross-cutting themes across an institution, or indeed across institutions across the country or internationally, across channels of complaint, services, provision and evaluation, you can't find the gaps in care, policy and evidence. And crucially, this enables higher education institutions to hide their gaps in care, policy and evidence, even though we all know that we're experiencing them. So in revealing these gaps in care, policy and evidence, we hope to make some kind of call for change. And this presentation was an attempt to reveal these gaps, the issues they enable to produce, to reproduce, and to stand in these gaps and take a stand for those who haven't been listened to or indeed have been silenced, and to make a stand for change. Thanks for listening to us.